Mike Hennessy. Mike is the CEO of MJH Life Sciences, which is the largest privately held medical media company in North America. They offer a broad array of media channels through which they focus exclusively on helping providers improve patient outcomes, which at the end of the day is what it is all about. And the company's continuous contact with providers, we think, gives it a special insight into in today's rapid pace of change.
And also thank you, DeSilva+Phillips, for inviting me to participate today. It's definitely easier to pull these things together in a virtual type of setting world, but I, for one, kind of miss the human connection, the opportunity to connect with some of the best and brightest minds out there. You know, the one advantage or disadvantage, depending on who you ask, of the virtual presentation is you're not really sure who exactly it is that you're presenting to. And you're unable to see their face, and if your message is on point, if you're resonating. But with that being said, here goes nothing. So for my portion of the discussion today, I was asked to highlight how MJH has been able to respond to this rapidly ever-changing landscape, and how we have seen U.S. physicians change their daily practice because of technology as well as COVID. So I prepared some slides that give everybody just a brief glimpse of who we were headed into COVID and what we look like today, hopefully coming out of COVID. So having 22 plus years of experience under our belt, we were extremely fortunate to have a lot of friends who offered us tremendous insight on both the HCP side as well as the industry side. And this is hands down what I deem one of our clear competitive advantages. And one of the reasons I'm putting up the mission statement here is because of the fact that even as we have scaled as an organization, we have held true to the entrepreneurial spirit and mindset. So this has allowed us to maintain that sense of nimbleness and push forth outside or out of the box ideas. And being able to pivot and innovate during these crazy times is what I truly believe and know is the reason our company has reached next levels of success throughout this crazy period of time. So looking at the MJH network, we have grown dramatically over the last few years. And one thing that you'll notice is that we have this house of brands mentality that we have embraced. So as you go from brand to brand, you'll certainly feel a level of commonality, but the one thing that separates us is the content strategy that we have. So each individual brand is for a specific audience. So we have quite the audience with more than 5 million healthcare professionals that are engaged with our content on a month-to-month basis. And this audience includes physicians, pharmacists, payers, and most importantly, patients, with market-leading brands like Onclive, Medical Economics, Cure, the American Journal of Managed Care, PER, and Pharmacy Times, just to name a few of the 50 plus that we have out there. So right here, you see a snapshot of some of the top thought leaders in just the oncology, the cancer landscape that our company works ever so closely with. Throughout COVID, we have had these individuals to thank in helping us push through these unprecedented times to meet their growing needs. The individuals on this slide do a number of different activities for our organization, whether it's chairing national prestigious conferences like Miami Breast Cancer Conference, whether it's regularly appearing on some of our video programs like our Peer Exchange or our Medical Crossfire, or simply just contributing content towards the physicians, the nurses, and the patients within the oncology fields. So this right here gives you a nice simplified snapshot of what we at MJH Life Sciences do from a day-to-day perspective. So headed into COVID, and still today, we have the 50 plus media journals, which is the core foundation of what we do and where we got our start back in 1998. And today we continue to publish these journals either on a monthly or even on a bi-monthly, 2 times per month basis. Outside of that, you have events. Events is still a big part of what we do, but it's just being done in a much different type of setting, as I'll share with you guys as we continue to go forth. And we're on pace to do roughly 65 different live events per month, so more than 2 per day. And then things obviously change up a little bit. And then the education front. So having a couple different educational sectors with PER, Pharmacy Times Continuing Education. We've done a number of different events that are meant to educate these healthcare professionals on almost a daily basis. This gives you a snapshot of some of the different feels that we've been able to produce from this live medium perspective. And we even have a nice little snapshot of Mr. Dancing with the Stars there, Derek Cuff on the middle to the right. So even that celebrity feel-good feel that we're able to produce for patients or nurses across some of the different productions that we put on. And then COVID-19 hits. So obviously live events, what was fueling our growth year after year, the opportunity to bring together these best and brightest minds to collaborate is what HCPs wanted. And at the time, the opportunity to connect with them is what our customers were looking for. So live events for us over the last few years went from 400 to 550 to 700 events, on pace to do more than 800 this year. So with COVID hitting, there's no more live events. That opportunity to connect starts to really go away. The opportunity to network, maybe not as much there. So for us, certainly a unique time, being a younger, newer CEO, and frankly, something that nobody else had experience with. A lot of thoughts began to go through my head. Do you begin to hit the panic button? Do you really feel bad for yourself? What exactly do you do? So luckily for us, I think we were a little too busy to figure out what exactly, or too busy to figure out if we should be panicking. And one story that I truly believe was a turning point occurred on Tuesday night, March 10th, I believe it was. And I got a call from the head of live events, and she told me that the event that we had that upcoming Saturday, which was a couple days before the New York City area really had shut down, the chairs of that event told us they couldn't go to that event. So after several different phone calls and several different conversations that we had over a 36-hour period, we had the chairs here in our headquarters in Cranberry, New Jersey, running a satellite studio out of our boardroom. And we did a combination of a live event / virtual event, and had to bring in a technology company to set things up. And it was that moment that I knew that during this period, we were going to get through it. You know, it would take a lot of time to figure out what exactly it was that we're going to do to shift these live events, but we had a nice opportunity ahead of us. I think we turned a lot of customers on the pharma side's head, being like, okay, these guys pulled together a very unique opportunity, and really were challenged with that particular meeting. You know, another thing that I think separated us was when the head of PER came to me and said, I got a fantastic idea, and that would be to do this webinar series. Let's bring together these physicians that we're working with ever so closely and get them to educate their peers on what their practices are doing. And it was a nice collaboration, because from week 1 to week 2, and we did this over a 20+ week period, the 80+ minds that we brought together each had a unique experience, and they were able to bounce ideas off of one another. And it helped us position PER even further as a market leading brand, as well as Contagion, which focuses on infectious diseases like COVID. So our business model today, you know, looks a little bit different. You know, you look at webinars and it seems like it's something so simple. It's something we didn't do a ton of as an organization. So Q2 alone, we produced more than 300 webinars, which is crazy. You know, 3+ webinars per day, pulling together a very captivated audience with some of the market leading brands that we're able to produce. And that was one of the key differentiators I think that we have here, the fact that our audience trusts us and continues to come in and look at this relevant content that we're able to produce for them. The middle two seem very easy, right? Interviews and events continue to go on. You know, the show can't stop. So as you know, some different conferences out there pulled back, and we continue to plunge ahead. So doing 1,500+ interviews, just like we're producing here, or virtual events, it became quite the commonality for us. You know, I told you earlier, we're on pace to do more than 800 live events as an organization this year. I'm proud to say we're going to do close to 900, maybe 950 events, whether they're virtual or live. And then podcasts. You know, this is something that we looked at almost 10 years ago to almost no success at all. And now we have 50+ different podcasts across all the different brands that we're producing. And it's pulling together a very captive audience to continue to educate them, whether they're on the go, whether they're at their desktop, an opportunity to continue to educate. And then we really had to push forth with some new platforms. So just like the telehealth opportunities that physicians were forced to kind of to produce and do with their patients, we were able to bring forth a number of different experiences. And one of the things I'm most proud of actually occurred on the animal care side of our business this year with our Fetch DVM brand. And last weekend, we were able to draw 2,500 veterinarians to come together for a virtual experience for a meeting that took place every single year in Kansas City. And we really didn't miss a beat. The experience for our customers, being the veterinarians as well as the pharma companies here, was fantastic. And we're even going to be doing another one later this year just because of the success of that. And then we launched our own platform. So similar to this Zoom or Teams, we have our reach technology. So the ability to go in and check the signal and strength and be able to produce virtual advisory boards and such is another key thing that has separated us during these crazy times. And then you see there on that bottom, that peer-to-peer interaction, the ability to bring together and get conflicting or similar mindsets from physicians as to how they might treat patients during this period of time. Another key differentiator is surveys and research. We had to continuously check in with the stakeholders. And one of the things that we did in May is begin publishing the State of the Physician survey. So what are some of the concerns that physicians had potentially with reopening? What kind of financial impact did this have on their practice? What is the office of the future exactly going to look like? And most importantly, what is this all going to mean for their patients and how they're adopting and adapting as we continue to go forth? Another key thing that we did is we checked in with the CEOs on the pharma side. How are they going to continue to shift as we continue to go forth? And do they see that being a trend, hopefully, as we come out on the other side of COVID? So we've been able to pull together 18 of pharmaceutical CEOs over the course of the last 3 months. And then another thing I'm really proud of is the launch of our Medical World News. So a 24/7 news channel. This is a goal that we had set for ourselves to launch by the end of 2022, in the beginning of 2023. We wanted to be that CNN of healthcare, bringing forth healthcare news, medical world news on a 24/7 type of basis. And the head of our content and I had a conversation in April, and we began laying together the framework as to how we pull this together. And throughout COVID, during these crazy times, we decided that in the middle of May, now's the time to launch this. And we have had 640,000 plus views with our audience here. So this is something that we're extremely proud of on our front. Couple things actually similar to what Erica just mentioned. We're working on a coalition on COVID. So we've been doing a number of different things, but we've assembled some of the best and brightest minds so far. And this is going to be a continuous thing that we'll be doing headed into the 2021 year. We did a webinar for the race for a vaccine, very timely towards the end of July. 5,000 plus registrants that were interested in hearing that material. And we just actually announced earlier today our next webinar that we'll be producing. And we're going to be doing advisory boards, checking in with these folks as to how they see the importance of this moving forward. A couple other things that we've been doing is the event side of our business is growing, continues to grow. Getting the publications, the foundation of our business in the homes of HCPs has been another key thing. So big shift from getting it in their practice now to getting it into their new practice. And we just want to make sure that we continue to bring the market new and impactful educational opportunities and programs. And I think, no matter what the state of the world is, the thing that we need to continue to do here at MJH is deliver high quality media content. We need to make sure that we're helping our HCPs learn and be educated as to what the latest advancements are. And we need to figure out a way to continue to do peer-to-peer interaction and education. And we've been able to do that so far. So thank you, Ken. I appreciate the time.